Hey guys, welcome to Podiatry Practice Mastery. Don here. I want to talk a little bit today about this whole venture with using a virtual assistant. So it's working out with King, which I talked to you guys about before. King is from the Philippines. He's an engineer by trade, but I guess he does better when he helps me or helps other people. I didn't go through kind of a virtual assistant service. I know there are ones like HeyRach and things like that, and that might be a better way. What I found with like HeyRach is you needed to do what days you wanted to use them, and but the price was pretty reasonable. I think it was about $6 an hour. I'm paying him $5 an hour, and for me it's fair. And what I'm using in terms of the workflow is I use Trello, Trello, and basically I have projects that to do, like a category to do, doing, and then done. And basically I put in different tasks that I'd like him to do. For example, if I do a video and I want him to do adding the cards or adding the description or doing things like that, I put that as a task, and when he finishes it, he puts how long it takes him. It takes him an hour or 2 hours and things like that. And there's a paid category, so once I get done with that thing, then I'll pay him. I haven't figured out quite how I'm going to do the payment yet. I think I'm going to send it electronically over to him and in the Philippines. And it's pretty reasonable for him, and he's more available. I had another one that was local. I was paying her $13 an hour. She's from my church, but she wasn't that available. She's looking for another job, and so this works better with King. So that's something that I found kind of interesting with him. He's very proactive. That's really the benefit. So he's interested in learning about how to use YouTube, how to increase my rankings, and he looks for new technology that'll help it. That's kind of one of the benefits as well. So he's kind of a go-getter. He has time to do these things that I don't have to do. So he's kind of setting up the videos. And my subscribers went up from 100 a month to 400 a month. I don't know if it's from him or it's because I've reached the 10,000 mark. I think when you reach a 10,000 mark, it starts recommending other people. And it's kind of my whole thought is, well, let's say I'm earning $200 a month on YouTube. That's what I'm earning about now. So I'm fine with him working like 40 hours a month. Because basically if it's a wash, because it's going to get people, the whole purpose of YouTube is to get them back to my blog and then add them to my list, right? That's the whole, or have them coming as patients. And so as long as that is kind of a wash, it's kind of like self-paying or paying for itself. My desire, though, to use King would be later on to use him for more things as well. I could also teach him, and I've used people to edit my blog or my website, just kind of doing these monotonous editing things that I have to do, that someone needs to do that I don't really want to do. So there's other things depending on really his capability level and how kind of a go-getter he is. Now, it's kind of a pain to set these things up, so let me tell you a couple of things that I did. So I have in that Trello, I have it's called a knowledge base. Basically, they are things that I used to use for Fancy Hands and these other virtual assistants that I've used. And basically in this knowledge base, I'll put website stuff, and then I'll do a screen video of showing them how to update a page on a website. And so then if I give them that task, I'll just have them look at that thing. Or if, for example, right now what he's doing is he's adding intros and outros to my videos, and then he's adding cards, and he's adding calls to action. So I'll make a video explaining how to do that once, and I'll put it in that knowledge base. So that's something that takes a little bit of time. You kind of need to figure it out first. Like these emails that come out to Podiatry Practice Mastery. By the way, if you guys haven't registered, I send out a weekly kind of a newsletter. On the podcast, you'll get the audio version of it, but really the video is better because you can see what I'm showing you. But to get that every week, you can either go to the blog on Podiatry Practice Mastery /blog. I don't think there's a link to that, but you can also just sign up and it'll send you that weekly email. That I'm learning how to do it. It's getting to be quicker. Once I figure it out and make it efficient, then I can pass that off to him. Okay, you can't pass things off before you learn how to do it. Okay, I've tried to do that. I try to abdicate versus delegate. and that makes it kind of a challenge. You're like, hey, unless that person already has that skilled knowledge how to do things, or even they might even be more skilled than you, then you can abdicate or just take care of this. But if it's something technical, I have to kind of learn how to do it. So I do it a number of weeks, and I'm learning. For example, with that update that I'm sending you guys each week, what I'm doing is I pretty much first make the blog, right? I take the video, upload it there, copy and paste it from the Google Slides, and then I add it to the email sequence. So it only takes about 5 minutes, but that's still 5 minutes that I have to do. So it would be much better if I could just record the video, send it to him, have him pull everything from the bottom of the Google Slides, those links that I put in there, and have it done. So it'd be easier for him to do it. Yes, it might take him a little bit longer, but he'll learn it, he'll be quicker, and I won't have to do it. The whole goal would be you could just do what you need to do and have other people do everything else. So for example, my goal would be I would make the video and just pass it off to him. And that's kind of the goal of having him. So that way you can do an infinite amount of videos if videos are really easier, or audios, or whatever you want to do. And then everything can be kind of self-propelling that way. Okay? Another quick tip I wanted to share is now we're getting busier in the office now. I don't know if everyone else is, but it's like packed all the time now. And, there's two rate limiting factors. One is documentation. And so I have really kind of an elaborate set of macros or these things within Athena that I use. And I'm going to need to set some time aside to improve the documentation, okay? Because a lot of times this documentation, I have these macros, but I'm always having to edit them. If you have to edit them multiple times, then it's better just to make a new one so you're not constantly having to edit it. Make sense? So it's just going to save you more time. And another thing within the Athena, there's two ways. Like a lot of times we're going through things. Like for example, with Achilles tendonitis, plantar fasciitis, and Haglund's, they're all really the same discussion for us. What we're going to go through because they're very, very similar. And what I find is the amount of treatments can be very complex. So that's why I use that whole checklist. If you haven't heard about my checklist, I have checklists for everything that I do. I have these Google Slides for everything that I do in the office, and it makes it a lot easier. And I'm not really using the slides anymore. I am just because I'm lazy to go get that iPad thing to play the video for the patients. But that slows me down. But if I have them watch the video and then I go through the checklist. Now the thing is, once you have the checklist, how do you tell them what to do? Because there's so darn much stuff. You're going to have them ice. You're going to do anti-inflammatories. You're going to do the velocity brace. You're going to have them come in for an ultrasound and for your first set of shockwave. All that stuff. So my partners, they write it out. They probably have some macros and they write that out and they have it printed. What I chose to do is something a little different. It's actually a foot pain checklist. It's basically almost like a prescription pad that I had someone make. And on there it has all the most common treatments for musculoskeletal issues. And I just check off the boxes. And it has like a area on the top where they can text their question. They can email me. So that might be something that you want to do. It was kind of a pain to make it, frankly. I found someone on Fiverr and I kind of had them lay it out and it looked good, but the problem is once you start using it you find edits. So once I run out of these packs, then I have to make a new version, and I'm going to delete stuff so it's just less complex, because as our treatments are always improving, we're always kind of changing how we're doing things. But this really helps. So every patient that comes in, they get one of these things. So I write down shockwave number 1, shockwave number 2. It takes me like 10 seconds to fill this thing out versus having to type a lot of things, because that just slows down. And when we're with patients, when we're seeing so many patients, I don't know how your practice is, but I do usually patients every 20 minutes. You might do it quicker, but that's all I can really do. And so that's new patients, established patients, shockwave, kind of whatever I'm doing. It's they're 20-minute visits, and then we double book like paronychia follow-ups or wart removal follow-ups or simple things like that. But these checklists, this written checklist, really helps because the patients are a little overwhelmed with what they have to do, especially if they have multiple things that they have to do. So those are kind of the thoughts for today. Hope you guys get your own virtual assistant. I don't have a good source for virtual assistants yet. I just found this guy. He was kind of referred from someone else. But I'd like to know if you guys have any great ways to get virtual assistants, let me know. Okay? Once again, join Podiatry Practice Mastery, and until next time.